today. Could you just give me your name and date of birth?
Betty Jones, 5/21/1952.
Perfect. All right, Betty. So it looks like Dr. Clements has ordered 1 unit of packed red blood cells for you. Do you have any allergies?
No.
No, so I confirmed that in the chart. I also confirmed my order within the chart. Miss Betty, have you ever had a blood transfusion before?
No.
Okay, so a blood transfusion is any kind of blood product, whether that be packed red blood cells, platelets, anything like that, that we would give you through your IV to increase your hemoglobin, or different types of labs if you had any bleeding, just low hemoglobin or things like that, to help get you better, okay? So some things I need to tell you about it. So we'll get some baseline vital signs, look at your skin and things like that. I'll get the blood down here. We'll confirm your blood type with the donor blood type, and then we'll get it hooked up to your IV here. So I do see you have a 20 gauge IV in your hand, so that works because we need an 18 to 22 gauge IV so that we can administer the blood product. Something that can happen during a blood transfusion is a transfusion reaction. So that can be anywhere from a rash on your skin to heart palpitations, shortness of breath, a headache. Anything you're not feeling right now and out of the normal for you would be a symptom that you need to let us know right away. If that were to happen, what I'm going to do is stop the transfusion right away, disconnect the tubing, get that all taken down, get it sent off to lab. They're going to run their tests. I'm going to get new saline and a new line and get you some fluids running in, and I'm going to notify the doctor so that he can give us some further clarification from there. Okay?
Okay.
Do you have any questions?
No.
No. All right. So, Miss Betty, first thing I'm going to do is I'm going to get some things set up in the room. I'm going to do baseline vital signs. I'm going to look at your skin and get everything documented so that we can call for the blood, and then we're going to get that all set up for you, okay?
Okay.
All right. Sounds good. I also see here that you have signed the consent form with Dr. Clements. Is that correct?
Mm-hmm.
Okay. And do you have any questions on that?
No.
No. All right, so I'm going to leave that at bedside because I'm going to put that in the chart. All right. Next thing I'm going to do is just make sure that your IV is working. So I did my baseline vital signs. I looked at my skin. I did a respiratory assessment and all that. Some lifespan considerations. If Betty was an elderly patient, I would run my transfusion at a slower rate, just for renal insufficiency. If she were a child, when explaining the process or transfusion reactions, I would have a parent in the room and use different words to explain different things that are happening, so that the child would understand, and that the parents would also understand so that they could keep an eye out for that. Some things I brought in the room with me are my blood tubing, sodium chloride that is not expired. I don't see any floaters in it, no layers, nothing like that. It's clear, it's good to use. Sodium chloride is the only thing that can be run with blood. And then I also have a normal saline flush that is not expired, and it is in fact 0.9 normal saline. Some alcohol swabs as well. All right, Miss Betty, so the first thing I'm going to do is I'm going to look at your skin here. I don't see any redness or swelling, no ecchymosis or anything like that. So I'm just going to lightly palpate here. Any pain or tenderness?
No.
No. Okay, perfect. So I'm going to go ahead and get started cleaning my hub for 15 to 30 seconds. All right, and then I'm going to unclamp. Actually, I'm going to take that off because I did not get rid of my bubble. Okay, we're going to re-clean with it. (15 to 30 seconds). Okay, then I can attach. Then I'm going to open my clamp. Betty, any tingling or burning sensation with this?
No.
No. All right, and my IV is patent. Perfect. All right. Take all my garbage. All right. done my baseline vital signs and my respiratory assessment. I'm just gonna get my saline ready for when that comes. Okay. Just gonna grab the garbage can, because I'm gonna need that. Writing for privacy. Okay. Miss Betty, do you have any questions?
No.
No? Okay. So I have my special blood tubing here. It has a Y port, which I'm going to close all of my clamps on. And I'm going to close my roller ball right away. Alrighty. So I've already made sure my sodium chloride is not expired and it's good to use. Alright. Actually, before I do that, oh my goodness, this one's real. Alright. Maintaining sterility. I can spike my sodium chloride. My clamp is closed. Alright. As all my clamps are closed, I can open my normal saline one. Fill my drip chamber to the above the filter. Once I'm done with my transfusion, I am going to take all of my supplies down and dispose of them in the biohazard or per my facility, wherever that is necessary. So Miss Betty, once the blood gets down here, we have approximately 30 minutes to get that started, okay? Alright. So I'm gonna, not touching the end of my cap, I'm just going to remove the cap and I'm gonna prime my line. Perfect. So I have my line primed and there is no bubbles or anything within it. Miss Betty, you don't have a history of COPD or CHF or anything like that, correct?
No.
Perfect. I've also confirmed that my order is appropriate for my facility and this is an appropriate order for my patient. I've also looked at my patient's blood type. So that's ready. I'm gonna go ahead and call for that blood, okay?
Okay.
Alright. I'm exiting the room. So that blood has come up in a package. So my blood is here. Miss Betty, I am back. I brought a nurse with me because we have to do some confirmation, making sure that the blood is the correct blood type for you and is safe to give, okay?
Okay.
Alright. Another consideration would be that my blood tubing is only good for 4 hours. If Betty were to need another unit of blood after this, I would have to replace my tubing if it's going to go over that 4 hours. So when we're done, I'm also going to do another set of baseline vital signs and a skin assessment or respiratory assessment because that has to be done within 15 minutes of hanging the blood, okay?
Yep.
All right. So much hand sanitizer. have my blood here. I'm going to invert my bag a couple times to ensure that my blood is ensure that is well mixed. I don't see any layers, clumps, no gas bubbles that are in my bag, so I know that it is okay to use. And I have Kaylee here. She's going to help me read through some information here. All right, so I have Miss Betty Jones, 5/21/1952.
Betty Jones, 5/21/1952.
Perfect. I have med record number 224466.
Med record number 224466.
Perfect. I have red armband 456654.
Red armband number 456654.
Perfect. I have patient blood type B positive.
I have patient blood type B positive.
I have donor pool number 7890.
Donor pool number 7890.
I have 4 units in the pool.
4 units in the pool.
I have a volume of 250 milliliters of packed red blood cells.
Volume of 250 milliliters of packed red blood cells.
The expiration date is 9/1/2024 at 1500.
Expiration date 9/1/2024 at 1500.
And I have a donor blood type of O positive.
Donor blood type O positive.
The compatibility test was completed on 9/1/2024.
Compatibility test completed on 9/1/2024.
Perfect. Thank you very much. So I'm never going to touch my blood bag without gloves on. So I've confirmed that this is correct. It is not expired and it is good for my patient. So I'm going to go ahead and spike my bag, make sure that my normal saline is closed. My blood is also closed at this time. Open the blood, prime it into the chamber, drip chamber. All right, and then I can prime the blood to the end of my line so that while I'm in here for the first 15 minutes, my patient is in fact getting blood and not just normal saline. So still not touching the end, making sure it remains sterile. I'm going to prime the blood to the end. Okay. And we do in fact have blood at the end. I'm not wasting any all. I'm placing my cap. All right, so I am going to go ahead and do baseline vital signs again so that they're done within the 15 minutes. Skin assessment, respiratory assessment, and document all of that. All right, Miss Betty. Let's see. I am going to put my blood in my pump. Turn my pump on. The cap was on, so my blood is still good. My blood is open. Their air bubbles would not be here. This is because we use this for testing purposes and video, so it gets airlocked a lot of times. My normal saline is locked. No, this is not a new patient. This pump has been used for Betty before and it's been in her room. All right, so channel select, guardrail IV fluids. I'm just going to page down, if the button works, to blood, red blood cells. Yes, I have a rate. I'm going to start Betty out at 50 milliliters for the first 15 minutes. After that, I can increase it, or it needs to be increased, so that we can ensure the blood is within the patient within the required time. And my volume, I'm just going to do 225 so that I know my line will not run dry and I can come back and get that started. All right, Miss Betty, we're ready to get started. Do you have any questions before I begin?
No.
No. Okay. I already made sure my line was patent. me an alcohol swab. And I already made sure my line was painted, so it's good to go. I'm gonna clean my hub for 15 to 30 seconds. Then I can get my blood tubing, remove the cap, and attach the IV. Okay, I'm gonna open my clamp, open my roller ball. My clamp on my sodium chloride is closed and my blood is open, so I'm gonna go ahead and hit start. Now that, Betty, I'm gonna hang out in here for about 15 minutes with you. Let me know if you have any, feeling any funny or changes or anything out of the normal, okay?
Okay.
All right, I'm gonna take my garbage. All right, so I'm gonna periodically do a skin assessment, respiratory assessment. I'm gonna be doing vitals every 15 to 30 minutes throughout the transfusion, just so that we can ensure no changes or some transfusion reactions are occurring. My blood has been infusing for 15 minutes, so I'm gonna go ahead and change my rate. I'm gonna just hit select channel, and I'm still gonna keep it low just for that lifespan consideration. I'm gonna start. My rate has changed. So once this transfusion is done, I'm gonna switch my clamps over, open the sodium chloride, close the blood, and let it infuse at the same rate into my patient so that I can ensure that she is getting all of those packed red blood cells. Miss Betty, do you have any questions for me?
No.
When I leave the room, I'm gonna document how many units were given, who gave them by me, the donor number, the pool number, the donor's blood type, the patient's blood type. I also confirmed that this blood type is okay to give to my patient before hooking her up. And if I'm not going to use the tubing for another unit, I would in fact go ahead and throw it away in the biohazard. So, all right, I think that's it. I'm going to take all of my stuff with me. I'm going to put this in the chart. All right, Miss Betty, the bed is locked and lowered. I'm going to make sure she has her call light. She's safe, the bedside table is near, and good to go. Thank you, Betty.